Fentanyl and Opioid Abuse by Group 32. Cassie, Jean, Angel, Katie, and Jeremy.
Fentanyl was developed with the intentions of using it for anesthetic and analgesic purposes. This narcotic is classified as a Schedule II controlled substance, which means it has a high potential for substance abuse and dependency. The problem with fentanyl is the synthesization of this opioid in substitution for heroin or other illicitly sourced drugs. Some factors that are attributed to this issue includes easy accessibility, low cost, and lack of user awareness. Fentanyl-related overdose deaths predominantly occur in the northeastern United States, mainly affecting those between 20 to 40 years of age.
The federal government has taken many initiatives to combat the fentanyl epidemic, including the FDA approval of opioid receptors. These can stop overdose and even prevent death, among other federal initiatives. The California government has also begun providing free fentanyl testing strips to avoid accidental exposure. This can alert someone if a drug is fentanyl-laced before they take it. In the most recent years, these initiatives have not been helping because of an overall increase in fentanyl usage due to the pandemic and its impacts on everyone's health. Even in the 3 years prior to the pandemic, there has been an increase in opioid usage despite the efforts that the state and federal governments have made.
Due to so much stigma about drug use, there's a lack of common knowledge about opioids. However, there's a lot of information and resources that can be found online that's readily available to the public, such as free rehabilitation centers, national hotlines, and local harm reduction centers.
Information surrounding opioid abuse is actually easily accessible on the web. Government organizations such as the U.S. National Library of Medicine and the U.S. Department of Health and Human Services have created websites that describe the dangers of opioid addiction. These websites also describe the severity of the epidemic, causes, symptoms, and other vital information and statistics that could help people cope or learn more about the epidemic.
Some ways to care for opioid abuse are opioid prevention programs and community-based programs that are funded by the government and are free. Some non-opioid treatments for withdrawal are also FDA approved. One major misconception about opioids is that those who are prescribed opioids will become addicted. This happens because doctors allow patients to do a self-assessment of their pain, causing doctors to give higher doses to manage the patient's pain.